I'm going to get into it in more detail, but the long and short of it is, Dr. Phil has just blatantly accused this woman of actual child abuse. Hi, everybody. So when I originally started this podcast, I did it with the intent to combat misinformation regarding the field of psychology and mental health, to try to increase mental health and psychology literacy among lay people and people who aren't in the psychology field. And one of the reasons I did that was because of Dr. Phil, funny enough. Dr. Phil, as much as I do think he has done a good job at increasing mental health literacy and knowledge among lay people and the public, I do think there are quite a few moments where he does significantly slip up and make some mistakes. I think that the framing of his show is not ideal. I don't like that he still kind of treats his show as some sort of performance or escapade or just showing off, essentially, people with mental health issues in some sort of, I guess, modern circus, for lack of a better term. I think it can be harmful at times, and I do think that he does get some things wrong regarding his interpretations or how he actually goes about talking about and handling these situations on the camera. So I thought, why not? Let's because these are apparently popular online, let's do a react video to a Dr. Phil episode. So this is a Dr. Phil episode I found where he's essentially talking to this mother who is extremely overprotective. We're going to see a lot more context within the episode itself. I will give a content warning. There is talks of child abuse, child neglect, and childhood trauma later on. It's not early on. It's mostly when the mother starts talking about her past. But that is something, if you're not prepared for it, totally okay. Just to let you know. I also do want to add, I am getting these clips from YouTube. I don't have every moment in the whole episode. I haven't seen it start to finish. I've seen what he's posted. But I do think even then, if there is something missing, it can't be too minor to my knowledge. I don't think he would post anything or refrain from posting something that would dramatically change the context of what we're talking about here. And even then, he still posted these 3 clips that we're going to watch today as standalone videos on YouTube. So I think it is fair to judge them as they are. If I am missing something, let me know down below. And if it is significant enough for me to change my views, I'll either unlist or take down the video because, again, I want to make sure that I'm being as honest and trustworthy as possible when talking about this. I also want to add, for the sake of this video, for the sake of, this reaction, I'm going to take everything everyone says in the Dr. Phil episode at face value. I'm going to assume that they're telling the truth unless otherwise specified. For example, if they say they didn't say something and then Dr. Phil shows that they did, that's a different story. But generally speaking, I'm going to trust them on their emotions, on their feelings, on their reactions. For one, I'm an outsider. I was not in the studio. I did not experience what they experienced. So I don't really think it's my place to question it, but also the fact that I think it would be pretty unproductive otherwise, just because I don't have the information to properly assess what is true and not true in this episode. I know there are people who kind of go into the, are they lying kind of body language stuff, but that's not something I really want to touch on here. Without further ado, let's just dive right into this.
I'm definitely a helicopter mom. I am absolutely psycho overprotective. I don't know any other way to be. My babies don't know that as they're sleeping, I put my hand on their chest and make sure that they're still breathing.
So immediately we see one of the very common themes throughout this episode that you're going to see a lot. This woman has a lot of symptoms that look a lot like dysfunctional levels of anxiety surrounding her kids' safety, what her kids are doing, all that. Now, I understand that as a parent, most, if not all parents are going to be anxious about their kids to some degree. They're going to be worried about what are their kids doing, who are their kids spending time with, are their kids doing well in school, are their kids, healthy and doing what they need to, all that. That's normal. That happens. But there does become a level where it is unhealthy and dysfunctional. For example, what she just said, that she checks whether her kids are breathing in their sleep. She doesn't mention any sort of medical complications that would justify this. There are, medical reasons, like people, like sleep apnea, where people stop breathing in their sleep, which could be a legitimate reason to check on your kids if they're breathing in their sleep. But she doesn't. So I'm gonna, based on what I know, this seems like it's purely out of anxiety, and this is very dysfunctional. It shows a lack of being able to cope with uncertainty surrounding her kids. Lack of being able to cope with her kids being in any position where she can't check on them all the time. And that's not healthy. We're going to see it more in the episode, but I really think this clip demonstrates this level of anxiety very, very well.
My son Chad was kicked off the baseball team because of my mouth.
Oh my God!
I get into altercations at the games with the coaches, with parents. It's almost gotten physical. I've threatened their families.
I don't think I need to spend a lot of time explaining what's actually wrong with this. Starting fights and threatening your kids' coaches, other parents at a kids' sports event is not acceptable, not okay, and it's not productive. In any sense of the word. I more so want to look at this mainly from like a developmental perspective on what is this teaching the kid? Because a lot of parenting is teaching your kid how to exist in the real world, on what to do in the real world, what to do when you are in certain situations, in certain circumstances. So in this case, for example, maybe the kid got in trouble, did a play he's not supposed to, was fooling around, something like that. I'm just saying hypothetically, I don't know the specifics. This is essentially teaching the kid that if something happens, if someone upsets them, if someone does something they don't like, the proper answer is yelling, screaming, and arguing, because that's what they're seeing their parent, their developmental figure, do. It looks as though this is not the takeaway from the kids, that the kids understand that this behavior is not okay, but I'm saying as a parent, this is teaching your kid not good lessons, because again, you are your kid's main agent of socialization, and you are socializing your kid to not handle these conflicts well.
One time, Robert came home with a B, and I was furious. I got in her teacher's face. I got kicked out of their school. If my children talk me into allowing them to spend the night somewhere, I do a background check on the parents. I make sure that the house has smoke alarms. While they're gone, I'm calling them, I'm texting them.
From this clip, and from what we've seen so far, I'm seeing the symptomology of two potential mental health concerns. And you'll see why I'm mentioning this later on. The first one is some level of anxiety disorder. I'm seeing a lot of intolerance of uncertainty, of potential for danger, or a lot of like what ifs. Mentioning when the kids go to someone else's house, she does background checks on the parents, she's calling and texting constantly, nothing can be out of her control, nothing can be like let out of her grasp, she can't tolerate things not being certain the way she wants. And when things don't go the way she wants, she gets upset, she gets angry, she yells, she starts fights. That is some level of an anxiety disorder there. Uncertainty is a normal part of life. You no matter how hard you try, you can't be certain of everything. It just is not possible. So learning to cope with that, learning to handle that and deal with that is really, really important, really crucial. The other thing I would mention is something called obsessive compulsive personality disorder. Now, this is going to take some explaining, but there's actually a very big difference between obsessive compulsive disorder and obsessive compulsive personality disorder. Obsessive compulsive disorder is a disorder characterized by certain anxieties, known as obsessions, and those anxieties being treated with something that relieves it for the person, also known as compulsions. The most common one is hand washing. So if your obsession is germs, bacteria, your hands being dirty, your compulsion could be washing your hands significantly to a dysfunctional degree where, you can't leave without washing your hands for 30, 40, 50 minutes, something like that. Or you're washing your hands so much it's interfering with your life. That would be an example of obsessive compulsive disorder. Obsessive compulsive personality disorder is a personality disorder characterized by rigidity, strictness, everything going exactly as you need it, everything being exactly perfect. This is generally speaking. There are specifics to it, but I'm just speaking generally. Obsessive compulsive personality disorder, it doesn't have those obsessions or compulsions. Weirdly enough, I don't know why they call it that then, but that's just what they call it. What I am seeing is things for this woman need to go exactly as she needs. She's very rigid and very strict. She is telling the story that she does all her kids' homework, and I'm going to play that clip later because I think there's a better place to put it. But she talks about doing all her kids' homework, and if her kids don't get a right answer, she just fixes it. If her kids come home with a B, she gets very upset and angry and goes to yell. And everything needs to go exactly as she needs it. She's very inflexible. She's very strict to, evidently, what is a very dysfunctional degree. Now, again, there's nothing wrong with wanting things a certain way. There's nothing wrong with wanting good grades. There's nothing wrong with wanting to be safe. But it gets to a point where it's just dysfunctional. And I think this woman is absolutely at a point where it is dysfunctional. And I want to clarify, don't use anything of what I'm saying as a diagnostic criteria. If you do believe that you have any of these disorders or want to know more, I always recommend speaking to a medical professional. This is just based on what I know. It's an assumption, and you will see why later because I do have a good reason for doing this.
If one of my children gets into a physical confrontation with another child, I will get one of my other children to beat up that kid.
So one thing about parenting and about raising kids that isn't talked about as often as I think should be is the fact that a lot of childhood experiences are teaching you how to handle real life situations later on. In this clip, she says that if one of her kids gets into an argument or an altercation, she gets another one of her kids to beat up the kid that started the fight with her kid. Obviously, bad behavior. Don't do that. That's very bad. But again, talking from a developmental perspective, your child is now not learning the skills to manage conflict and arguments and any sort of problems on their own. Now, obviously, when, kids fight and have their arguments, it's usually not serious. It's, they got into a fight because of how they're playing or yada, yada, yada. It happens. It's okay. The problem comes in when the kid doesn't learn how to handle those kind of situations. Typically, when you're a young kid, you learn that yelling, screaming, fighting, arguing, throwing hands, all that is not productive. If you get into a fight with somebody and, if you get into an argument with somebody and you immediately start hitting them, it's not productive. It's not going to help. It's not going to fix situations. It's not going to do anything. And while this might not seem that bad when they're a kid, think about it now when they're an adult. Because I can guarantee, tell me in the comments below, you guys, everyone watching this has probably at some point had an argument with either their boss or a coworker or a colleague or a professor or a teacher or something like that. You've had some sort of argument. And when you're older, when you're an adult or even an adolescent, like a teenager, like 16, 17, something like that, you can't just hit people. You can't just yell. It's not going to work. It's not going to be productive, and it's going to be a lot less tolerated when you're older. But because you have not developed those skills, those techniques on how to communicate and work through these problems, you're not going to know how to handle it. And that's very concerning. As long as the arguments aren't really bad, even then, I don't think you should send your kid to beat up other kids. I think if there is physical aggression going on, you as the adults should step in and separate the kids. But even then, this should be used as a learning opportunity to help your kid handle these situations on their own. Bringing the kid aside, talking to them, saying, hey, how can we handle this? What can we do? How can we solve this situation with your friend? Because once they learn how to do it, the next time, you're not going to have to step in as a parent to solve this situation. You're not going to have to step in and break apart a fight because your kid's going to know how to handle these situations. And then when they're an adult, when they're working a big boy job or an adult job or a big girl job, they're going to know how to handle it. They're going to say, okay, my supervisor's yelling at me. My boss is mad at me. What do I do? How do I communicate? How do I say what I think, what I need, all that? And again, this also applies to other adult situations, adult friendships, relationships, everything. So ultimately, you are taking away an opportunity for your child to learn how to live in the real world and how to handle situations in the real world. Because, again, you're not going to be able to protect your kid at their job. Are you going to show up every time a supervisor or boss gets upset at them and talk to their boss? That's not going to look good on your kid. It's going to look terrible. They're going to have such a hard time finding a good job in the future then.
Okay, but here's the thing. You say it's for their benefit.
Absolutely.
And you think you're doing the best for them, right?
I do.
Okay, tell me what your children benefit when you do their homework.
I don't do all their homework. I mean, let's be fair.
I will 100% give credit where credit is due with Dr. Phil. I think this is a very good way of approaching this. Directly asking her and addressing her thought processes, which clearly she recognizes are not entirely logical or rational, and directly addressing them and talking through them and directly asking her, how do you think this is helping, to make her say it. I think this is really productive. It's very easy to sit back and point and say, this person's doing everything wrong. That's not entirely the most productive angle, but getting them to say it, getting them to admit it, getting them to say it can be really useful. And I like this approach from Dr. Phil. I think this is very, very good.
Robbie, Mom is rewriting your essay.
Why? What is wrong with my essay?
Listen, this is the first paragraph. You wrote, have no time to eat. You need to start with...
Mom, I'm in middle school. I'm not in high school yet.
Okay, but...
Mom, wait. You want me to try. Let me try. Don't do it for me, Mom. I really want to do it myself. Because if you do it, then it's your grade, not my grade. It's practically cheating.
I really like this kid's approach to this situation because he's absolutely right. If someone else is all you work for, you just writes all your essays, you're not learning anything, and you are basically cheating. What would happen if, let's say, he did hand in an essay that his mom wrote? Either he gets a good grade and he doesn't learn how to write, or what made his essay good, or even strategies on writing essays that he could use, because that's another thing you learn when writing essays, not just the actual writing, it's how do you write? How do you get inspiration? How do you word things? How do you edit things? How do you change things? Working with other students and other people to get them to edit your work and help you with your work. That's another thing. There's so much of the writing process that is just taken away when other people do it. But also, if he hands it in and, the essay she wrote gets a bad grade, he can't learn anything from that. Her mistakes are not his mistakes. He doesn't learn anything. What I would recommend, because he's still young, he still has the opportunity to learn, and he clearly wants to learn how to write. What I would have encouraged in this context is, I actually have an essay I wrote here, because I had an essay for uni, and my professor offered to do a page rating where they pointed out my mistakes, but they wrote specific notes on what I did wrong and how I could fix it. And I still use this on future essays. I take the notes, I look through it, and I change it, because I can look at this and I can be like, I should word this better. I don't need to put as many citations here. That kind of thing. That I can learn from. That I can apply. She, from the looks of it, wasn't even going to tell him what he did wrong. She was only starting to tell him once he walked in, which is very concerning. Very, very strange. And just yet again, another opportunity to learn taken from these kids.
It makes me feel really embarrassed when my friends say, "Why aren't you allowed to spend the night?" I just say 2 words, "My mom," and they understand.
It is very embarrassing. Then they get really angry at me and they don't want to be my friend anymore.
So obviously it is really upsetting and, heartbreaking to hear that these kids are losing friendships, losing connections because of how their mom is acting. But again, I also want to look at this from a bit more of a developmental perspective. Because as we grow up, as we age, we have multiple of what are called agents of socialization, which are basically the people who teach us how to act in society. This includes parents, teachers, and even friends, because there are some things that one group can teach us that the other group can't, and vice versa. And all these groups working together are what help raise kids and raise them into good adults. You can't have one group teach everything. You can't have just your parents teach you everything, because there's some things that parents aren't going to know. The dynamics of childhood friendships, the dynamics of working amongst other kids, the dynamics of solving problems with other kids. I'm 22 currently. If I had to, solve a problem between two 10-year-olds, I wouldn't know what to do. I wouldn't know what to say. I don't know. But by talking to other kids, by talking to other people their age, they can learn it that way. They can connect that way. There's also stuff like modern either trends or discussions or social fads and stuff that gets transmitted through these friends that doesn't get transmitted through the family. And there's also the aspect of when you are around differing types of kids, different types of people, you are more likely to notice things about you that might need, I don't want to say changing, but maybe addressing. So a big example. A lot of cases of ADHD are noticed in schools. And the reason for that is when you are only watching one kid all day, it can be hard to notice things like that. But if you're sitting in a classroom with 30 kids, it becomes very easy to notice when there's a couple kids being particularly hyperactive that might need additional help with that, right? So that's an example of where just being around other kids and associating and talking with and connecting and communicating with other kids is very helpful. Very, very useful.
You don't want a violent breakaway from her, do you?
I love my mother.
But you've had to get away from her.
Yes,
correct?
I have. Mm-hmm.
What did you do?
I was 14 years old and I ran away from home.
To get away from her?
Yes.
Okay. What do you think about that?
It killed me. I thought I was going to die. I laid in bed and I cried and I couldn't do anything. And yes, it was about me. Yes, it was at that time. And then I grabbed myself up and the babies, and then I thought I still have these guys to take care of. So I put all of me in them.
It was this clip that really made me start considering making this video. Because this is the strangest response I could have ever pictured to this sort of question. basically the conversation, I had to cut a lot of it out for like copyright and all that, but essentially the long and short of it is Dr. Phil talks about how kids need to gradually gain their independence and break away from their kids or from their parents. And he's absolutely correct. He's not wrong there. But that if the parent tries to be more controlling, it becomes rebellious and explosive and pushed back a lot harder. Which, again, you're not wrong. And her daughter says that she had to run away from home at 14 years old. And her response was, "It killed me. I just laid in bed, crying. I thought I was going to die." And the odd part to me is she talks a lot about wanting what's best for her kids, wanting to do everything she can for her kids. But her first thought in this situation wasn't, is my kid okay? Where is my kid? Is my kid with somebody trustworthy? Can my kid get food, water, shelter? Does my kid know how to contact the police if needed? Does my kid know how to get to the hospital if needed? It could be possible that in the episode she stated where she went. Maybe she went to a trusted friend's house. Maybe she went to an aunt's house. Maybe she went to somebody's house where the mom knew that the kid would be okay. That is possible. But based on what is shown in this clip, none of that is said. That it says that her first reaction was, "Oh, this hurts me, and I just need to take care of my other kids." And that's very, very, very strange. Because it kind of shows that the core concern is a bit beyond caring for her kids. And I don't mean that to say like, oh, she doesn't actually care for her kids. I mean that to say like, maybe there's something more here than just she cares too much about her kids. Again, this goes back a little bit back more to that obsessive compulsive personality disorder and that intolerance of uncertainty. With your kid being out of the house, it is possible that became so overwhelming for her anxiety-wise, so distressing, destructive, painful, hurtful, that she just coped by controlling her other kids even more. And that would be telling. Not in the sense of, oh, I'm trying to pin something on this woman, but it makes what the problem is a little more clear. Because, I read through some of the comments, and it's a lot of people saying stuff like, oh, she just cares about her kids too much. She just loves her kids too much. And I don't want to accuse this woman of being of not loving her kids or faking it or whatever. Again, I'm taking her at her word. I'm just saying there might be a little bit more to what she's going through than just caring too much for her kids. And it is mainly based on that response because that genuinely confused me quite a bit.
You think I wanted to? You think I wanted to leave my family? No.
Answer her.
I thought you wanted to just get away from me.
No. I wanted you to hear
And
me.
I hated myself for it because I knew it was because of me. I knew it was.
I wanted you to understand.
But then that made me grab onto the other ones even tighter.
I think that this is a moment where Dr. Phil could have jumped in and made a point here. I think the first thing he could have said was, from my view, I see that she is acknowledging that she did do something to cause her daughter to want to leave. And that's a very good first step in addressing, stuff happened. You did something wrong. That's great. But where do we go from here? How do you fix it? What exactly did you do wrong? Because just knowing that you vaguely did something wrong is not inherently like the solution, because it doesn't directly say how to fix things. I think Dr. Phil should have cut in and said, okay, I'm hearing that you're remorseful. I'm hearing that you're in pain. What do you think you could have done better to stop this? And then see what she says, and then kind of go from there, because that could have opened up a whole new door of what exactly is she doing wrong? Does her daughter agree? Do her other kids agree? Does she know? Is she just going to say, I care for my kids too much? Because that is also something else to address if that was her response. There's a lot more left on the table here that I think could have been addressed. I also think Dr. Phil should have let the daughter speak more, because you can tell the daughter was trying to get something out and say something and make the mother understand. But she interrupted, and she wouldn't let the daughter finish, which, really made anything she was going to say moot. She didn't really get any point across, which, again, not really productive. I think Dr. Phil could have cut in there and said something. Another thing is this lack of agency in what she does. And this is a common thing with people who are struggling with any sort of mental health issue, is they don't feel as though they can really control much. They feel as though everything is out of their hands. The woman said, that made me grab onto my other kids more. And it almost seems as though she's trying to remove an aspect of her responsibility from the situation. And this is another thing I think Dr. Phil should have addressed. He should have said, evidently, there's something you're trying to cope with here. There's something you're trying to work through here that you are using caring for your kids and being close with your kids to try to cope with. What is it that you're trying to cope with? We're going to see that later, but again, these are key points that I think he could have touched on or should have touched on. I'm not expecting him to cover everything in one episode. It is Dr. Phil. It is daytime TV. This isn't actually like how therapy would play out in a real therapist's office. But I still think it's important to touch on some of these things because Dr. Phil is probably one of the biggest modern names in the field of psychology, and facilitating productive, appropriate, helpful, meaningful discussion and demonstrating it on TV can be very important and be very helpful for people who might be struggling through something similar with their family, who might be struggling to talk about it.
What would I be without them? I don't want them to hate me.
But do you understand how that puts your agenda ahead of theirs? It can get to the point of being really unhealthy.
It is.
Have you ever heard of the term Munchausen?
No, sir.
Take a look at this definition I put up for you. Munchausen syndrome by proxy is a controversial term that is used to describe a behavior pattern in which a caregiver, that's you, deliberately exaggerates, fabricates, and or induces physical, psychological, behavioral, or mental health problems in those who are in their care.
It was at this point in watching these clips that I knew I had to make this video, because this is probably the most irresponsible thing I have seen from Dr. Phil. I'm going to get into it in more detail, but the long and short of it is Dr. Phil has just blatantly accused this woman of actual child abuse. First of all, Munchausen's, or Munchausen's by proxy, is the outdated term for this disorder. I don't know how old this clip is, so it could have been the relevant term for the time, but the more relevant and more modern term is when it's done to yourself, factitious disorder, or when it's done to somebody else, factitious disorder imposed on another, or FDIA. I will be calling it FDIA for the rest of the video, just for to be correct and to be modern, which is proper terminology. The thing is, FDIA is not just doing something that harms your kids, doing something bad to your kids. There's a specific process to it. I have a source, I'm going to read it from my phone, from the Cleveland Clinic talking about this. I'm going to link it down below, but I'm going to take some excerpts from it to explain what I'm talking about. What is factitious disorder imposed on another? Munchausen syndrome by proxy. Factitious disorder imposed on another, formerly known as Munchausen syndrome by proxy, is a mental health condition where you claim that someone within your care needs medical attention even though they don't. A person, usually within your care, could be a child, usually under the age of 6, a person with disabilities, or an adult over the age of 65, for example. What are some symptoms of factitious disorder imposed on another? If you have this condition, you might tell a healthcare provider that someone within your care is experiencing symptoms they aren't usually experiencing, physically harm someone else to cause symptoms, like withholding food to prevent weight gain, change the result of diagnostic tests of someone, like contaminating a urine sample, or interfering with someone else's treatment plan to prevent them from getting better. So factitious disorder imposed on another is specifically when you are harming somebody in your care, particularly a child or an elderly person, to give yourself some sort of reward that isn't entirely clear. And the reward can't be entirely clear because that's a different thing, but essentially, it is where you cause your child harm, specifically in the medical sense, to make yourself look better. Now, unless a huge chunk of this episode, and I mean massive chunk, has been cut out, none of that is present. We never see this woman intentionally harming her children to make them look sick, tampering with medical records. We don't see her claiming they have symptoms. We don't see anything like that. We see some questionable parenting tactics. We see her taking away some opportunities for development. Totally fair. But we don't see any of the symptoms of FDIA that are normally present. And it is important to note that while FDIA is a mental health disorder, it is still child abuse. If a parent intentionally harms their child to make them look sick, tampers with their medical records, or does something to prevent them from getting better, that is abuse. That is mistreatment. 100%. And Dr. Phil just accused this woman of it. He took a vague, bad definition of the term and put it on this woman. Now, I don't blame this woman for this, because she's not a mental health professional, but Dr. Phil knows better, and he should know better. And this is extremely, extremely irresponsible. The other thing that I don't like is using the term Munchausen in the first place. apart from it being wholly irrelevant to the situation, Munchausen's is a term that is very stigmatized and seen in a certain light. If you've watched any sort of hospital drama, there's always an episode with a parent with a patient with Munchausen's, or a patient with Munchausen's by proxy bringing in their kid 100 times, or accused of having Munchausen's by proxy, or something like that. It is seen in a certain light, and it is seen in a way to they're usually portrayed as like manipulative, sneaky, that kind of thing. And given that Dr. Phil later talks about this woman's trauma, the links that I could see people making, I don't like. I'm immediately seeing somebody say, oh, this woman is doing child abuse, but she's traumatized, so she can just get help, so it's okay. I know that's not what Dr. Phil says, and that's not what he says, but that's a conclusion someone could come to based on what is shown. It is putting out a lot more confusion than needs to be, when you could have made this a lot more productive and a lot more beneficial, frankly, for the general public. The biggest thing I would talk about is anxiety around your kids. Anxiety around your kids, obviously not to this degree, is a common thing parents can experience. Again, almost every parent, I would say, has some level of anxiety towards their kids. What are their kids doing? Who are their kids spending time with? All that. And it can be a hard thing to cope with. This could have been a fantastic opportunity to talk about that, to talk about ways to cope, ways to face that anxiety. What do you do when you're in that situation? How can this mother feel more comfortable? What steps can she take to feel more comfortable with letting her kids take small risks? And that could have also inadvertently helped other people. Maybe parents who are not at this point. Maybe there's parents who are anxious and maybe struggle to let their kids hang out or stay out past, a certain time when their other friends are outside. Maybe there are some parents who are a little bit overbearing, who are struggling with that similar anxiety, who could have taken a lot away from this. But no. He doesn't do that. And that is what very much frustrates me. Extremely frustrates me. Point is, Dr. Phil, you should know better. You should absolutely know better and do better.
You've got a young man down here that you won't let do his work, so he doesn't develop the skills he needed in the 5th grade, 6th grade, 7th grade. So you are inducing in him a dependency on you because you just said, it's all I have.
I was originally going to cut out this little ending part of this clip, mainly because it's just Dr. Phil not understanding FDIA more. Like, not letting your kid do their homework is not FDIA at all. But what's interesting here is another common problem that parents could face that they could have gotten advice for and help for, and that is empty nest syndrome. Not being able to cope with your kids being independent and leaving the house. Another thing that parents could experience, that they could struggle with, a common anxiety, a common worry, that Dr. Phil could have given some advice for. He's using this opportunity to scald this woman when she's clearly showing remorse. I don't like that. Like, what is this meant to do, Dr. Phil? She's already showing remorse. She's already showing she's upset. She's already showing, she regrets what she did. Like, she's not fighting back. She's not pushing back against you. She's crying. She's, accepting anything you're throwing at her. And you're just scalding her more. You could have absolutely used this opportunity to explore, to just ask, okay, well, what do we do next? What do we do from here? How do we help you cope with this? How do we help you cope with, your kids being the only thing in your life? How do we get you more supports, more meaning, more help in your life? All could have been fantastic things to touch on here, to end off on here. Again, nothing. Absolutely nothing. So many opportunities to talk about real, legitimate problems people watching this could have taken away from and helped with. And he does none of it. And that's the most frustrating part here. The next video is the last one in this trilogy here. And this is the part where they start talking about abuse and neglect. And this woman goes into her traumatic past. The details are a little bit graphic, not super graphic. But if that is something that bothers you, you're free to click off the video. I'm warning you here. You're free to go watch something else. And thank you for watching up till now if you have.
I'm positive my past affects how I parent. When I was 12 years old, I was abused. He held a knife to me and he grabbed my hair and pulled me down the steps. He would always pinch my.
So, this is part of the reason why I really don't like Dr. Phil. We see a woman who is using helicopter parenting and overbearing parenting to cope with some actual trauma and pain. And it's particularly a bit distasteful to me to cut the videos as he did. It is only in the third video where this is mentioned. I am not trying to use this to justify this woman's behavior. I do think, however, it makes it a little more distasteful that in terms of the way Dr. Phil handled it, in terms of how he showed it, in terms of treating her as this haha, funny, crazy helicopter parent, and then immediately being like, oh, she's actually traumatized. It feels distasteful to me. It might be a personal thing. This could just be like my personal preference, but I don't like how this feels. It feels gross in my stomach. I don't like it.
I felt completely abandoned. I am very, very angry with my mother. So when I had my kids, I was overprotective because I didn't have that growing up. I love you. They all have to know that they're protected and no one ever is allowed to hurt them. Never.
So essentially this woman shares that she feels as though, because of the abuse and the neglect that she experienced in her childhood, she's jumped to the opposite extreme of not wanting anybody to hurt her kids in any way, shape, or form and preventing all harm from coming to her kids. I don't really want to psychoanalyze this with other potential possibilities. I feel that's a little bit distasteful on my end. I'm not a licensed therapist, so I can't do that. What I will say is I can see where her thought process is and where she's coming from. But it's important to understand that as a parent, the role is not to protect kids from all harm. It's teach kids how to cope with harm, how to deal with harm. In life, there are harms, pains, anxieties, fears, worries, hurts that are inevitable. Absolutely inevitable. Grief, losing people, breakups, losing friends, getting a bad grade, failing tests, failing assignments. These are all things that are going to happen. More than likely going to happen at some point. When you're a kid, it is your parents' responsibility to teach you, what do you do in that situation? How do you handle it? How do you cope with it? Where do you go to get that support? And also, by developing those friend groups, you find other people you can turn to when you need that support, when you need that help. And it's about building those resources. Trying to prevent any and all harm is just not realistic. It's not possible. Harm is going to come in one way or another.
Amy, I'm really sorry what happened to you. I'm really, really sorry. That was not right. It was not fair, and no one helped you. But look at me. I'm here to help you now.
Thank you.
I'm here to help you now.
So, this is a very bad clip for me. It doesn't sit right with me. First of all, it feels really gross and wrong for this woman's essentially unpacking of her pain and trauma and her breakdown emotionally to be a TV thing. I think this is honestly something that should have been put to the back, behind the scenes. Dr. Phil talks to her, empathizes, lets her cry it out a little bit. And then for TV is where you talk about next steps. How do you heal from this? How do you cope? What do you do? None of that is discussed here. The clip just ends with Dr. Phil repeatedly saying, I'm going to help you. We're going to get you the help you need. We're going to help you. We're going to help you. We're going to help you. And I am picturing a layperson, maybe who struggles with anxiety as a parent, maybe who struggles with childhood trauma or processing something like that, watching this, hoping for some kind of help or advice or anything. And all they get is essentially Dr. Phil saying, don't worry, I'm going to fix this. What are they to take away from that? What do they get from that? What have they taken from watching Dr. Phil? It feels very empty, and it almost feels as though Dr. Phil is using this to make himself look better. The clip is just Dr. Phil saying, we're going to help you, I'm going to help you, I'm going to help you, I'm going to help you. Really? That's all you got? I'm going to get you the professional help you need? Like, okay, that's great if you can afford it, if you can find it, if you have a therapist you feel comfortable with. But if you don't, then tough luck, I guess. The reason this frustrates me is because a lot of people struggling with mental health issues, a lot of times the first level of help is self-help. Books, podcasts, shows like Dr. Phil. Somebody with trauma, this could be their first exposure to any sort of discussion or talking or visible advice for this. And Dr. Phil doesn't offer anything. And that feels like a very big missed opportunity for me. I firmly believe he could have used this to educate and teach people about what to do in this situation. You know, you're trying to process childhood trauma. You're trying to process the grief of your, goddaughter being in that accident. You're trying to process the anxiety of being a parent and your kids growing up and potentially leaving or making a mistake or being hurt or something like that. There's a lot that this woman's going through that Dr. Phil could have used to give very good advice to not only her, but other people watching. Many parents experience anxiety surrounding their kids. Many people struggle with processing grief when someone in their family passes on. Many people struggle with childhood trauma and processing trauma and dealing with it. And I can imagine that some advice could be extremely helpful for them here. I do not have the same qualifications as Dr. Phil, so I can't give the same level of advice that he would be able to, or a professional would be able to. The best I could give at this point, because I do want to give something. If you have some form of anxiety, the general best consensus is facing it head on. And I know that sounds cliche. That sounds really silly. That sounds really dumb. Like, oh my God, just face my fears? How easy is that? It's not easy, but how your body works is it's very lazy in the sense that it wants to use the least amount of energy possible at all times. It is why, for example, when you drink coffee, your heart rate goes up. Your body doesn't like things being not the way they're supposed to, so it tries to force it back down. If you drink coffee in the same room every morning, your body's going to drop your heart rate the second they see those cues, because it's a lot easier to drop your heart rate earlier than after it's already up. Now, this same thing applies to anxiety. You might have some sort of connection or stimulus response to something that causes anxiety. If you put yourself in that situation, either gradually or all at once, and sit in it, your body's going to see your heart rate rising, your body's going to see you sweating, your body's going to see any sort of response, and it's going to gradually try to push it back to normal. This, combined with other relaxation techniques that can be used, are very, very beneficial. And eventually, teach your body to not associate that stimulus with anxiety, with panic, with fear. Obviously, this really depends on the phobia, or the anxiety, or the specific fear, and how it's approached. In this woman's case specifically, I would definitely encourage her to, for example, let's say like with her kids' homework, don't do your kids' homework for a week. Don't even ask them about it. Don't even watch them. Don't watch them do it. Just stay 100% away from it. And just sit there. And let your body go through the process of going back to normal. And after that week, see how they did. Is their homework done? Is it good? And likely, the homework will be fine. It's not going to be like PhD level thesis, but it'll be fine. They'll get good grades. Evidently, the one kid wants to do well, so the homework should be fine. And then her body will gradually realize, okay, it's okay for my kids to take risks. It's okay for me to have uncertainty. Now, this can be a process, and this is very different for each person, so this isn't like a fix-all solution. But this is a very good starting point for dealing with anxiety. This goes for any sort of situation. If your phobias of dogs, it could start with, the gradual method could be looking at a picture of a dog, seeing a dog from a distance on a leash, watching a dog on TV, standing while a dog sniffs you, and then eventually petting the dog, something along those lines. In a social setting, just putting yourself in situations where you need to make those social moves, where you do need to say things socially, to make your body realize, oh, it's okay for me to say things. It's okay for me to do this. That's the biggest tip for anxiety. Regarding childhood trauma specifically, I don't feel qualified enough to touch on that. But generally, looking up resources from qualified psychologists and professionals. You can always, I suggest you really do research on who you're reading, who you're consuming, to see if they're a pop psychologist, if they're just somebody trying to make money or grift, or if there's somebody actually in the field studying, trying to spread good advice and good information. Regarding the grief aspect, grief is a very difficult thing to process, but it is a thing everyone has to learn to process. People die. It happens. It's unfortunate, it's heartbreaking, but it happens. This is also something that's very difficult for me to comment on, as I don't have enough experience, I don't feel, to comment on specifically what people should do. But a really good starting point is that social support. And that's a very common theme in psychology, is social support. Support groups, talking to your friends, talking to your family, letting your feelings out, just really trying to process everything and talk through everything, because there could be a lot of feelings there and a lot of thoughts, and some of them might not make sense in the moment. But as long as you have people around you to talk to about them, to share them, to feel safe with your feelings, that can be a huge step forward in really getting comfortable with that grief, with that pain, with that hurt there. That is all I wanted to cover in this Dr. Phil segment. I think that he really dropped the ball here significantly, honestly. I was just looking through clips to see what to find. And this was one where I feel he could have done so much better than he did. And it's not just that this is not a good Dr. Phil segment, right? Like, you could pick any Dr. Phil segment and nitpick and make fun of things he says or whatever. I think he genuinely had an opportunity to give broad advice to people who needed it and who could use it. And he just didn't. Why? I don't know. I don't know what his thought process was. I know he was irresponsible with his use of the word Munchausen's and accusing that woman of child abuse on TV. Let me know what you guys think of this video. I'm trying different types of content where I can and trying to make time for make content where I can. If you guys like this, let me know. I can definitely make more of these. This was generally a really fun time to record and talk about this and share some points where I think Dr. Phil could have done better. Leave a like, subscribe. Thank you very much. Bye.